Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, wow, super excited to have you here. Welcome. We're bringing some really exciting conversations with some incredible leaders that are painstakingly changing the future of healthcare. And if it's your first time tuning in, let me just sort of take a quick step back and tell you exactly what we are trying to do here. So we're focused on bringing stories of innovation to life, folks that are truly innovating within our space down in the trenches, and to give them the opportunity and the platform to be able to share their stories with our community and ultimately the world. And if you haven't checked out any of the historical interviews, make sure you hit the subscribe button now, wherever you are, smash it, please. It's super helpful. We've got just an amazing, incredibly action-packed year with some phenomenal guests, one of which we are interviewing here just shortly. I'll introduce him here. But in our field, things are moving fast, and it's crucial to have leaders that can envision the future and eagerly embrace innovation and to address a lot of these pressing challenges. And our next guest on the show is actually one of these leaders. Please welcome Beau Sorensen, the Chief Operating Officer at First Choice Home Health and Hospice. He's a visionary leader who's profoundly impacted home health and hospice for the last 25 plus years. And he's an active member of the home care and hospice community. Beau has served as legislative director and president of the Utah Association for Home Care. He's been a stalwart advocate for the industry, presenting in national platforms and symposiums and talking about critical topics like customer loyalty, AI in healthcare, and developing strong organizational cultures. He's a recognized expert in several software systems, having collaborated with Allscripts to test and develop significant new features in their home care application. And they led First Choice, set a groundbreaking precedent in adopting fully electronic chart system across the nation for home health and hospice agencies. So first of many of the things that they've been doing. So aside from his impressive professional achievements, Beau is deeply involved in politics and advocacy, championing the cause of home health and hospice, both in Utah and in Capitol Hill. And today, Beau joins us to share his insights on the future of home health, hospice care, the role that technology plays in transforming patient care, and how we can continue to push the boundaries of innovation. So, Beau, welcome to the show. It's great to see you.
It's good to be here. Thanks so much for having me, Michael.
Yeah, of course. So let's give people a little bit of a flavor of some tour of duties that you've done. Give us a little snapshot, sort of, who is Beau Sorensen in a minute or so.
Yeah, so I most of my career has been at First Choice Home Health and Hospice. I have done pretty much every job that you can do here that isn't clinical. So COO, CFO, office manager, chart guy. If it's a job that's to be done, it's a job I've done. So I've done all that. I've also done a lot of advocacy work, as you mentioned, with the National Association for Home Care, as well as the Utah Association for Home Care, to try to make things better for our patients as well as for our industry, and get things moving that need to be moved on Capitol Hill. And I've also done a lot of work with the Home Health Financial Managers Association and worked with them to create content for national conventions and things like that, so that we can hopefully push things forward in our industry. One of the things that I've found is that our industry is not as forward thinking as, say, Apple or Google. And so one of the things that I think I bring to the table is getting us to that point, or at least helping people to see some of that vision. I also do consulting work with Vision Bound International, and have talked with companies around the country about ways that they can better use their medical record systems. And as you said, customer loyalty, also employee loyalty, work-life balance, AI, technology, all of those fun things.
So let's pick a topic. It seems in sort of our pre-conversation that you'd like to fix stuff. You're not the traditional CFO. You roll your sleeves up. Where did that come from? You've been a fixer your whole life?
I have. Well, one of the things that at home my family always talks about is, if something is broken, then I'm the one that gets in there and I figure out how it needs to get fixed. And it might be a computer, it could be the vacuum, it could be a car. It's just getting into it, and I have the confidence to say, if I take this apart, I know how I can put it back together, so it won't be worse off if I don't fix it than it was if I started trying to fix it. So I can get things put back together and just kind of have a mind for that spatial awareness to say, okay, here's where everything goes. So yeah, I like to do that not just with physical things, but also with processes. And it's something where my wife has actually said, you don't need to fix everything. I'm going to just tell you stuff. This is not for you to fix. This is just for you to hear. I don't want you to fix this. And so, in that case, I will step back and I'll say, okay, I don't need to fix this particular thing.
So you've spent a lot of time growing up in this organization, and you mentioned you've done a number of different roles within the organization. As you start to assess opportunities to make improvements, how do you prioritize those? And can you list a few of the improvements and opportunities that you and the team have been able to sort of assess and make some changes?
Yeah, absolutely. One of the things that I've used is trying to figure out how technology fits in. I love technology. I've loved it since I was a kid, and as I've seen the impact of technology in my personal life as well as in other industries, I say, how can we take that and move that into our industry? Because our industry is not technologically savvy, and it's not for lack of trying, and it's also not for lack of education. We've got a lot of highly educated people, but their brains aren't wired the same way as somebody who goes and works as an engineer at Meta is. And
Yeah.
so they don't necessarily think of these things, and I do, even though I didn't ever end up in Silicon Valley. But I say, how can we use this technology to make things better? And one of the things you mentioned in the introduction was bringing that our entire charts and making them electronic. And we were the first company to do that in our industry. And it was because I said we're spending all this money on a chart room, and not just in people, but in rent and in printing things, because you'd print them out and then you'd bind them in a binder and then you'd put them in a shelf. And it just didn't make sense. It lived in the electronic record. Why can't we, instead of bringing things out of that record, put them into the record and make it so that people can actually use them instead of them sitting somewhere that nobody's ever going to look at unless they're there for a survey? So just things like that I said, how can we get information? How can we get things more usable to more people quicker? Another area, and this is, that was 15 years ago now when we went fully electronic, but coming up to the present day, it's saying with artificial intelligence, how can we utilize this in our industry? Because it's making a profound shift in certainly technology, in programming, in banking, and all over, but it hasn't really hit our industry yet. And so we said, how do we want to use this to really move things forward? And we're working on several initiatives now. One that we've done and is complete, and we've actually seen a 75% reduction in our cost of what's called an Oasis review, which is it's coding and payment impact. And so what it is you have to pay somebody to do it. And AI is bringing all of that information directly to the person who's deciding what we
Right.
need to code this and how we need to do it. And as a result, they don't have to go hunting and pecking around a chart for that. It all comes to them. They're able to dramatically reduce the time, which in turn reduces the cost. So that's something that is really exciting that we've just barely done. We also partnered with a telehealth firm. That's a nut that we have tried to crack for about 15
Right.
years. And the biggest part of that is, how do you crack telehealth with no payment? Because our industry doesn't get paid for doing
Right.
telehealth. So we partnered with a company that actually can get paid for using telehealth. And so now we're getting that out to all of our patients. We'll get access to the data and the information. They'll get access to bill. And so we think that in this case, it's done it, but a lot of times it just comes down to trying and erroring and trying again and failing and then finally hitting that actual solution.
You're kind of touching on it, but I mean, because you and the team, you've achieved some pretty fantastic outcomes in improving clinical efficiencies and just operational performance. When you look back, I mean, if someone is not within your shoes but is doing what you're doing, how do you cultivate a culture of innovation and continuous improvement among teams who are dealing with uh, the stresses of healthcare delivery?
Yeah, that is a really, really good question. And a lot of it is you have to bring in somebody who has that the right skill set. You probably don't have it in your organization, and to try to tell everybody, hey, just get this mindset, just be technologically
Yeah,
savvy,
yeah,
and make that happen. One of the things that I talk about a lot is that a lot of times we tend to focus on our weaknesses, and we say, okay, well, where I'm weak, I'm going to just put all my energy, and that will make that weak thing better, and therefore I will be a better person, or I'll be a better manager. But in most cases, when you focus on that weak thing, it doesn't have nearly the impact that focusing on something that you're strong in does. And so instead of trying to fit those round pegs of clinical people into a square hole of technology, trying to bring in, either an outsider who can consult with you and move things forward, or alternatively, if you have somebody who sits at the nexus of healthcare delivery and technology, bringing in that person and creating a role for them and saying, okay, you're going to do this, you're going to lead this up, and having them bring their strengths to the table instead of you trying to spend all your time and energy and effort into doing that, neglecting your other strengths, and ultimately not getting the impact that you want to see from that kind of innovation. So really, a lot of it comes down to bringing the right people, because you probably don't have them in your organization yet.
Hmm. And talk about collaboration, the level of collaboration that the admin team and the clinical team have. What's that like? What is that relationship like? And what are those, how often do those meetings occur? Like give us a, peel back the covers a little bit and give us some.
Yeah, so we meet with our clinical team, our managers once a week, to talk with them about the things that we're thinking about and get their feedback on any ideas or innovations that we're bringing. And we don't go forward without their say so, because one of the things that we found over the years is that if the different managers, be it a clinical manager or somebody in the office who this is going to impact, if they have resistance to that, then they will throw sand in the gears of your organization to stop that innovation. And when they do that, not only does that impact the speed that you can actually move forward on with your innovation, it also impacts trust across the organization, and it gets people to say, well, I don't trust these people because this person that I trust is telling me that they're doing things that are harming them. And so we want to make sure that we get everybody on board and talk with it. Really, it's not a single person at the top who's pushing all of this innovation. It is a person who's bringing this innovation to the team deciding, yes, this is something we want to do moving forward, discussing it as necessary. And sometimes those discussions take a little bit of time. It's not something where you're
Yeah.
going to get out in 5 minutes and say, okay, we decided we're moving forward with this new innovation. But as they see this process work, that time dramatically decreases. And what was a 4 or 5 hour meeting about this, so that may have to come back and be a meeting again, turns into an hour meeting where you're discussing, here's what it is, here's how it will impact your team. Them saying, we see these problems with it. Can you help us with that? Resolving those concerns and then moving forward together. It really has made a profound impact on the trust overall in our organization, not just in the speed that we're able to innovate with.
Yeah. So it sounds like a few things. Alignment is huge, and it's not a push, it's a pull.
Mhm.
Tossing out ideas, you're collaborating, and steadily over time, you're incrementally making these changes. I'm curious because there's innovation and having the empathy to try things. How do you strike that balance between, harnessing cutting edge technology while ensuring that, the empathetic human side of care is not only just preserved, rather enhanced?
Uh, yeah, one of the things that we do is any innovations that we bring to the team, we try to keep it within the framework of our organization and within our mission statement. And we say, listen, our overall objective here is to give amazing service to our patients. It's to give excellent clinical care, and it's to make them feel like we care about them, because we do. Be it people in the office or people in the field, we care about those patients that we see, and we want their lives to get better. And so everything that we bring is with an eye towards that. And that may be that you say, how can this office innovation, how can decreasing the amount of time and money that you spend coding help your patients? That doesn't make sense. And the way that I would see it is it does help our patients, because reducing that cost in the office means that that is now money that I can spend on patients. Those I can give it as raises to my field staff. I can give it as more clinical care. And by doing that, I'm actually enhancing their life. And so even in things like that, we always frame it in, here's how it's going to actually help us hit our mission. And by centering everything around our mission, it really allows us to continue to focus on the right things, as opposed to just having innovation for innovation's sake, and or doing
Right.
something that maybe harms the patient. And that doesn't mean that we don't do things sometimes that are a negative and that take away some of that personal touch. And so through the innovation process, we have small teams that we roll it out to, and those teams give us feedback. And as that feedback comes in, then we either roll it out further or we peel it back and we say, this isn't quite hitting what we want. And there have been times that we've reversed course and said, this is not right, and pulled the plug on a program, and that's okay.
You mentioned something around the delivery of care aspect, and I'm just sort of curious in relation to innovative approaches. What innovative approaches have you seen? Let me back up for a second. There's been a lot happening in the home health space. There's been a lot of talk and commotion about, delivering care to patients at home. And home health has always done this, has been able to sort of reduce the cost of care. And as someone who, I've spent some time in home health, it wasn't always necessarily perceived as being at sort of the top of the totem pole.
Mhm.
How does it feel now knowing that all along, you've known that you've had an impact on care and readmissions and what you can do to continue to keep a patient at home? What's it like now that the roles are reversed and that there's a bit more of a focal point on home health?
It's really gratifying, because, like you said, for 20 years we've known that we are the solution to, or one of the solutions. I don't want to be so bold as to say the solution, but we are definitely one of the solutions to reducing the overall cost of care, as well as improving health and safety of patients. And yes, your doctor's going to see them. Yes, they're an integral part of that care. And yes, you may need a hospital at times, but getting home health in there and making sure that we take care of you in your home can have a profound impact on you. And it's great to see that it's being recognized now, and that really the pandemic, I see as kind of the inflection point where that finally turned and people said, oh, folks want to be at their houses, they don't want to be in a facility. And to which I'd say, yes, I could have told you that 20 years ago, but I'm glad you're recognizing it now. And it's awesome to see. I think that we need to do more. We're recognized now as a part of this healthcare system, and really a vital component of it. And we need to now say, okay, how can we expand this? How can we make it better? And it may not be traditional home health as it is today. It might be a version of home health that is a little more hands off, where the patient is being monitored, but a nurse is coming in, maybe not every 60 days, maybe it's just as needed as the vitals say. And we're really bringing in more population health management style tools, because that is going to be what is going to keep people out of the hospital. The sooner that we can track things and check things and get people on the right health path, the sooner that, or the more that they're not going to need to go to a hospital or to a doctor or some other higher care setting, higher cost setting. And that's going to really, I think, make a difference in this $3 trillion industry that we call healthcare,
Yep.
and save people dramatic amounts of money. So I love doing that, because that's something that is fantastic. It's great to say I do good and I save money, and there's not many jobs where I can say that.
Well, there's a lot of talk and a lot of commotion around value-based care. When you think about it, I mean, home health is an aspect of value-based care. You're given a lump sum to manage a patient across an episode of care, and you need to be a good steward of those funds and make sure
Yeah.
that they're used appropriately.
Mhm.
How knowing that there's more um, Medicare, Medicaid patients kind of coming into the need for these types of services, how do you address, what kind of things are you working on to bridge the gap um, in healthcare disparities, especially amongst a lot of these underserved communities?
But one of the things that we are doing is first and foremost, a lot of these Medicaid patients and some of these other patients who are I would say less advantaged than your traditional patient population.
Right.
Um, they are in more difficult situations, and it requires more flexibility. And that flexibility could be working with your clinicians to make it so that their lives are easier. And some of the things we do, it's not necessarily all, hey, let's use a computer to solve this. Sometimes it's giving them as clinicians caregiver burnout sessions so that they can um, care for these people who really have more acute needs and more difficult life circumstances than their traditional patients that they are used to seeing, and getting them energized so that they can give their all when they're out of those patients. Sometimes it is saying, how can we reduce your overall paperwork burden? And that's where, again, technology comes in and saying, okay, let's use AI and let's have it look at this. And let's make it so that it is not as much of a barrier as clinicians have traditionally felt that healthcare terminals are. And let's get this so that it's almost seamless and you're not even seeing what the technology is doing, but it's doing it for you. So you can put all of your energy and focus into the patient. And then once you're done with the patient, even in that difficult circumstance, if they're living under an underpass, if they are in a homeless shelter, if they are in a home life situation that really is not good for them, you can still give them the care and energy and attention that they need and that they deserve, while at the same time completing your job and not feeling burned out to the extent that you would think that you would with some of those difficult cases.
Interesting. I want to switch gears for a moment because I've been thinking about, as you've been kind of talking about efficiencies, there's been some external forces that have been happening within the home health hospice space as it pertains to reimbursements.
Mhm.
And as reimbursements start to dwindle, what does that do in terms of, is that forcing your hand to have to innovate, to have to look at technology? Do you feel like that's a force multiplier to look at things like AI and with, a lot of these digital health tools that are rapidly evolving? Where do you see the role of, human caregivers sort of shifting within the next, few years? How do we kind of prepare for some of those changes?
Now, I think that there's always going to be I say always, but things change. I can't see a future in which there's not a human that is in the loop giving that hands-on care. It just, while people sometimes say that they feel more empathy from ChatGPT than they do from their doctor, that just because a computer is able to uh, kind of mirror what an ideal human would be, that doesn't mean that they can give the same level of care, certainly in a hands-on perspective. I see, however, that being a key part of it. And having chatbots and having things like that where a patient can ask questions and say, hey, what's going on? It queries your medical records and gives them vital information that they need so that you don't have to involve the nurse all the time in those non-hands-on type of settings. I think that, when as you talk about, is the reimbursement challenge a multiplier or not? I would never say that no money is a multiplier. I do think that it does force innovation though, because you have to find different ways to do things, and if you don't, you either adapt or you die. And the companies that are going to survive in a continued reimbursement challenged environment are going to be the ones that are innovative and that find new ways to unlock the potential in their systems and to do it in a very cost effective way, while at the same time maintaining as much money as they can for that hands-on care, because that is going to still be an absolutely crucial part going forward. And nurses and therapists and aides, all of their wages are going to continue to go up as inflation rises. Their needs rise, and as their needs rise, their wage needs rise too. So that brings even more attention and focus onto AI and onto technological innovation to say, how can we get rid of some of this stuff that is bogging them down, to either reduce the time that they spend, thereby reducing some of the overall pressure on wages, or alternatively, how can we use that to then reduce the amount of spend in the office, and still get the money that we're owed by insurance companies and
Right.
Medicare and whatnot, but do it in a way that doesn't involve as many people, so that then we can continue to shift money out to the care of patients.
Well, give us some examples. I mean, you mentioned, one earlier around the Oasis review. What are some other ones that you're proactively, working on? You don't need to tell us, details and, go into IP or anything, but I'm just very curious, where are you actually applying AI today?
Yeah, another area that we are actively focused on, we don't have it rolled out yet, but is on chart reviews. And one of the biggest burdens on our agency is making sure that our charts are complete and compliant with government and insurance regulations. And the way that we have historically done that is with a person reading those charts and saying, okay, here is the nurse, and here's where they were weak on their documentation. Let's send it back to them and have them review it and then get it back to us. And then we'll go through that review process again. And that is something that can take days, as well as days just in terms of getting it from point A to point B and then back to point A, but also a lot of hours in terms of people's time reviewing those notes, people's time adjusting those notes, and then going back. And so we're working on using AI initially in the back office to audit all of that information automatically and call out to a human to say, okay, here is where there are some problems that I see. What do you want to do about that? Do you want to send it to the clinician? Do you want to correct it yourself? Or do you want to disregard it? And so that is step one. Step two is actually getting that into the clinician's hands and saying, okay, we don't have to just have this in the office. This is going to be your co-pilot to tell you, yes, your documentation is good. No, your documentation is not. Here's what I would fix. Here's some recommendations. What do you think of those? Do you want to put those into place or do you not? And making it so that that is at point of care and at time of care, really doing those audits and making sure that everything is compliant with those regulations for us. So it reduces the overall stress and burden on the nurse, because no nurse that I've ever met has said, I love paperwork and I want more of it. They say, I want less paperwork. And so it's working on that. And another area that we're working on is saying, there's all this information that can be collected from the patient and from these encounters that we have. It's the way that they walk, the way that they talk, and the way that they move, and a lot of these questions that we have are, how are you doing with walking, moving, etc. And by using the cameras on the devices, we have an extraordinary source of information that we can tap into that can actually give us better knowledge than even the clinician's observation. And so you meld those two things together, reduce the overall time that the clinician has to spend on those assessments while getting better information. So those are a couple of other areas that we're really working on innovating on right now.
Super exciting. That's really encouraging to hear. So I know we're kind of winding down, but this question's been burning in my mind because I know that you've been doing quite a bit of advocacy work on Capitol Hill and through your state. What's been most surprising in terms of barriers in influencing healthcare policy, and how did you sort of address it to, benefit just your home health and hospice compatriots?
I would say the biggest single barrier that I find is the pay go. And so whenever you go and talk to a senator or a representative, be it on the state side or be it in the federal side, they always say, well, this is great. How are we going to pay for it? And inevitably that pay go has to come from your industry. And they say, okay, well, you're going to ask for another $1 billion. So now we need to find $1 billion of cuts. Find them for us, please. And the interesting thing about that is that when you talk to me, I say, okay, well, why am I trying to find $1 billion when I'm trying to get $1 billion? That doesn't make sense. It's like saying, go talk to mom, she'll give you $10. And mom says, okay, well, I'll give you $10, but you have to then give $10 to your dad. And it's like, well, that's just going around in a circle. It doesn't make sense. Where instead of that, if we said, and let's look at the healthcare system as a whole and say, where can we reduce costs, and let's look at it holistically instead of in silos, I think that we would be able to really see some profound transformation, because the money would start to go from some of those higher cost areas where maybe the money's being wasted or whatever, to say, if we're going to reduce hospitalizations, then let's take that savings in hospitalizations and put that directly to home health care so that we can then drive that further. And that's one thing that anytime that they do a GAO analysis, they find that we reduce hospitalizations. And if we're reducing hospitalizations, it seems like you'd want to encourage that because that's going to save you money in overall emergency care.
Right.
But it doesn't. It just says, "Oh, thanks for the savings. We'll continue on. Keep doing this for what you're doing it." And that's one thing that I haven't necessarily found a way around. A lot of times you just have to give, continued knowledge and effort to these people to say, listen, we understand that there is only so much money. We want to be a part of the solution. Here's how we can help us help you, and then move forward together. And I have found some success, especially with the more that we get to know those offices, the better it
Right.
gets.
Yeah, relationships are key, right? That's
Absolutely.
what makes things move around. So how can folks continue to follow your work, follow the innovation and the transformation that's happening at First Choice Home Health and Hospice? Give us a little bit of a commercial where we can learn more about that.
Absolutely. So you're always free to reach out to me. I'm not going to say I get back right away on my emails. Sometimes it does take a few days, but you can reach me at b@fchhh.com. I'm happy to chat anytime. I also go frequently to conferences for the National Association for Home Care. I'm speaking at the Financial Managers Conference this spring, or excuse me, this summer. The annual meeting that we have this fall. And I'll be talking about artificial intelligence because that is the thing that is on everybody's mind, and it's certainly on mine. It's what we're really seeing some innovation in. You can also find me on LinkedIn and follow up with me there. I haven't been historically great at that. I'm getting a lot better at responding to messages there as well, though.
Hey, it's been really nice. But we always close with the same question, which is, for those that are tuning in, if there is one nugget of action that they can take, what's your suggestion to this audience, to someone who's listening? What's one action that you think they can take from what you've shared today and implement? Because it's all, innovation's about implementing and doing. It's not just about sitting back and listening and, hey, that's great. But what do they do? What's the one thing you would want our folks to take action on?
The one thing that I would say is oftentimes it's start. It's just make that step, because you think of these great ideas, and I've thought of tons of them, and I remember thinking about them at conferences and when I'm walking around in different cities and saying, this would be a really great idea. And then I never did anything with it. And that's great that you have a great idea, but it's not going to ever go anywhere. It's not going to help anybody. Don't be afraid of failure on that. Say, this is a great idea. Let's explore it. Let's start moving down that path. And that might mean starting with checklists and saying, okay, what are the steps that it's going to take to put this out? And step one might be as simple as writing this checklist. Step two might be as simple as talk with a friend about it. Any of those steps that you can take, all the way from I've got this great idea to implementation, move down that list and start doing it, because too often we're afraid of failure, or we think, I don't know how I'm ever going to do this. It's not possible. It's always possible. You can do it. You just have to start, and you just have to move forward. And that forward momentum will carry you in a lot of places you had no idea you'd ever go.
Brilliant. Simple, yet effective. When you start, you create momentum, and that's what keeps the flywheel moving. So for those of you that have tuned in, if you found this conversation to be uniquely helpful, we'd love to hear about it. We'd love for you to share it with your network, maybe comment on it, see how you want to, maybe some topics that you'd like to hear more about in the future. So Beau, it's been great to have you on. Obviously, we always tell our guests they're welcome to come back and share other learnings, other little wins. It's always nice to hear from you. So good to see you, Beau.
Great seeing you too, Michael.